Preventive dentistry is at the heart of our practice at Denmark Dental. Preventing dental disease is actually preserving a pleasing smile, preserving comfortable chewing, and preserving a lifetime of good dental health. The structures that we strive to preserve are the enamel on your teeth, which enables comfortable chewing and good digestion, skin on your gums to maintain the firm connection of your teeth to your jaws, and then of course the underlying bone in the jaws that supports the teeth and that supports your facial contours. Let's take these one at a time. We preserve the enamel on your teeth by helping you avoid tooth decay and by early treatment and repair should decay occur. Decay begins on the surface of the tooth, either on the chewing surface or between the teeth. Toxic acid wastes given off by the colonies of bacteria in your mouth eat away at the hard surface of the enamel. Once this hard outer layer is penetrated, the bacteria and their toxins continue to burrow into the tooth, making a bigger and bigger cavity. If left unchecked, this cavity will burrow right into the inside of the tooth, causing pain and infection. Next, we'll talk about why keeping skin on the gums is important to prevent gum disease and tooth loss. Skin, as you know, is the protective outer layer of our body. Two of skin's functions are to keep blood in and germs out. When blood is leaking out of the body, germs can get in to cause infection. When a finger suffers a mild cut, most people put on a Band-Aid to protect the break in the defensive barrier of the skin until the cut can heal. We need to be just as concerned when our gums bleed, and for the same reason. Bacteria and other microorganisms, along with their toxic wastes, form colonies along the gum line. These colonies can be seen if allowed to grow undisturbed. The toxic wastes from these germ colonies are very irritating to the soft gum tissue. This irritation results in a condition not unlike diaper rash of the gums. Under this attack, the skin cells break down, blood leaks out, and bacteria invade further into the tissue and under the gums. If allowed to continue, this process will actually attack the supporting tissues, including the bony foundation for the tooth. This can finally result in loss of support and loss of teeth. Now, let's take sort of a generic look at the disease process. In any disease, there has to be the host, or the person who actually gets the disease. In this case, we're concerned with you and your teeth. Then there is the environment that makes the disease process possible. With dental disease, it is the inside of the mouth that is dark, warm, rich in nutrients, a primary breeding ground for bacteria. Then there is the disease agent, the direct cause of the disease, called the pathogen. With dental disease, we're talking about the bacterial colonies that live in your mouth, on your gums, and on your teeth. These colonies of microbes, called plaque, give off toxic wastes that decay teeth and attack your gums. When these three components work together, disease results. That disease is decayed teeth and gum disease. The ways that we deal with this disease process is to do something to shift the balance between disease resistance and disease susceptibility. We want to shift the scales towards resistance. Throughout life, we encounter things both inside us and outside us that can shift that balance. Some of us are born with more resistance to disease, some with less. That we can't change. We're focusing here on what we can change. We talked about the environment within the mouth that promotes disease. Poor diet with a lot of refined carbs, especially sugars, feed the plaque that cause the disease. The reverse is true. To preserve health, healthy diet, effective plaque control, fluoride use at home and professionally applied, and regular dental care all support health. As you can see, there's not too much that is mysterious about preserving health or giving in to disease. You probably already know much of what I've told you here. The challenge for all of us is to realize that learning is not changing what we know, it's changing what we do. So I wish you well in your efforts to preserve your dental health.